Hi there, it's John here. Just wanted to first of all start off by saying thank you very much for everything you've been doing over the last few weeks. It's a worrying time for us all, for our service users, their families, ourselves. But what I've been really impressed with is how people have already started to pull together to work out how we can respond and make sure that people are looked after as well as they possibly can be. A little bit about what's going on, both locally and within the Trust. There's been a slowly increasing number of COVID-19 cases, but we still have significantly less than in most parts of the country, which is good news. There is, however, some pressure building in our local acute trust where there are more people being admitted to hospital with COVID-19. So what we're trying to do is to work out what we can do to support them so they can stay on top of the level of demand that they're facing, and so that we can ensure that our services continue to be as good as they possibly can. We have already been setting up arrangements to ensure that we coordinate all of our activities. We have what's called a gold command, which sounds rather grand, but that's how we collect together all of the information, the guidance that's sent from on high, to ensure that we're ready to be able to respond as things build in terms of pressure. Two things that are particularly important to us and to the NHS more generally are what's called PPE, personal protective equipment, and testing. So at the moment there is a reasonable amount of supply of personal protective equipment in the Trust. We're not unduly concerned about it, so that as and when we start to see more patients becoming positive, we have the necessary equipment to safeguard staff to reduce the risk of them becoming positive. The area that we're particularly keen to progress, however, is testing. We're able at the moment to test some staff, we're able to test some of our service users when there are signs that they may be positive, but there's little capacity to test staff. We're told nationally that will change very soon, and indeed it may be possible to actually do self-testing, so we can each actually get hold of a test kit and test and check for ourselves whether we are or aren't positive. Of course, the advantage of being able to test ourselves is that we will relatively quickly find out whether we're positive or not should we have symptoms, and if it proves to not be the case, we can come back to work very quickly rather than having to self-isolate for 7 days or indeed for 14 days if we're living with somebody who is showing symptoms. What we're also trying to do is ensure that staff can, where possible, work from home to reduce the risk of becoming infected when they sort of share spaces with other colleagues. We've also made the decision very recently to ensure that staff who are in the situation where they may have symptoms or are living with somebody who does, that they should work from home or be off sick for 7 or 14 days. That way we're seeking to make sure that staff and indeed our services are protected and safeguarded. Returning to our plans to be able to respond to the pandemic, we've been asked to open 1 or 2 new services, one of which is being described as a mental health A&E. And the idea there is to help relieve the pressure on acute hospitals' A&E departments to enable us to take people directly to our service rather than being routed by the A&E, perhaps being taken by an ambulance or by other means. As well as that, we're also looking at how we can increase capacity locally across the system, working with third sector organisations and with local authorities, so that for those people that are already quite worried by what's happening and concerned by the uncertainty, that there is support available, primarily through third sector organisations, but with us providing support to them, ensuring that the service is of a good quality and safe. Finally, I'd like to return to where I started off with a huge thank you to everybody that's made a contribution to ensuring that our services remain good quality and available for people. That includes our nurses, our doctors, our psychologists, our therapists, our support workers, our cleaners, our catering staff, and all the staff that are in the sort of behind the scenes roles, such as workforce, finance, commission court assurance, communications, etc. I know that it's difficult for people at the moment, and we've got to try and make sure we maintain the balance between looking after each other and ensuring that we've got enough staff to deliver a high quality service to those we're here to serve. Thank you very much.